Hey guys, my name is Monica and I am scheduled to have my surgery tomorrow morning at 7 a.m. I'm due to have a rhinoplasty, which is known as a ethnic rhinoplasty. So what that means, it's not just reshaping the nose but also fixing the septum, which is slightly deviated. I'm undergoing my surgery with Dr. De Silva. I have met him 2 times before my operation date, and I just wanted to talk to you about my experience so far and how I felt, and just in general what bothered me about my nose. So in terms of picking my surgeon, Dr. De Silva, I knew about him about 1.5 years ago, but at the time I didn't feel ready to go for it. I wasn't in a settled position. I think the most thing that bothered me about my nose was the actual bridge of it, which I will show you in depth later on, and also the fact that the loop over here just drags really low, so whenever I smile it just didn't look right. So I wanted it to be lifted, I wanted it to be straightened, and I also wanted the septum to be in the middle. I didn't really notice that, but Dr. De Silva said this was the best option for me. So my nose and my appearance started bothering me when I was about 12 years old. I just turned 22 yesterday, so a long 10 years of battling with this. But I feel like now I'm in a settled position to make this decision, and I feel like I've met the best surgeon and I feel comfortable with him. When I started planning this, I planned it earlier on this year. It's now October, so January I started looking into consultations with Dr. De Silva, and then I managed to book it mid this year. My first consultation, I met one of his lovely scrub nurses who works in the theatre, and she also is able to stay with you along the journey of your operation, and she has been. She just looked at my medical history, what I'd like to change about my nose, whether or not I had any support from my family. At the time, and still now, I don't have that much support, but my partner is very supportive, so they were there for me. She also looked at why I wanted to change my nose, how long it's been bothering me, whether I've been bullied, and on a scale of 10 how much it affected me. To me, it affected me 8, 9. I used to get embarrassed driving because I hated my side profile. I used to get embarrassed smiling because I thought my nose was drooping too low, and I'm nervous for tomorrow, but I'm excited to finally make this hopefully the best decision of my life. She spoke to me for about half an hour, went through all the paperwork, what to expect from surgery, and then I met Dr. De Silva, who was very kind, very reassuring. He listened to everything that I wanted and gave me realistic options. I explained that I hated the bridge of my nose, and he also noticed that when I was smiling it was drooping low, which is what bothered me. So he said he would straighten the bridge, lift the nose a little bit. He did explain that sometimes it could be a change because you're not used to looking at your nostrils, but overall it would give me more of a feminine look, and that's what I wanted. He also explained that a rhinoplasty would be better as my septum was deviated to my left hand side, so just to reshape it and make it look a lot better. He also did a little examination of my nose there. I don't know what it was for really, but just to see maybe my structures. And then he just took a good few photos of me, showed me what it would look like before and after. When I looked at the photos, it was brilliant. That's exactly what I wanted. It was realistic, and he said this is what was achievable for him and I. He listened to everything that I wanted. He gave me the time, he gave me a pack to take away. He also was able to let me take the photos away with me, so I'm able to see the difference. And he also said to me, if there's any concerns at all, do not hesitate to call. I have kept in touch with his nurse that works very closely with him, and she's been very reassuring. I live very far from London, so they've been able to support me with accommodation and where to stay and just everything really. So now, talking about my nose, you can't really see in this camera properly, but I will show you that to the side there is a really big hump that I don't like, and when I smile it droops low. There's always one side that bothered me more, and I think it was this side. I don't know whether that's because my septum was deviated to the left side so it looked better, but on this side I feel like it is a lot more humpier. And also Dr. De Silva said he's going to reduce the bulbous over here because it's quite fat here, and I wanted it to look a lot more slimmer, like my bridge, and a lot more feminine really. I don't know whether you can see properly in here, but my septum is deviated, and you can tell that by my nostril sizes. So this one is a lot bigger than this one because my septum is deviated. Dr. De Silva said that it wouldn't really make too much of a difference unless people would look from right underneath you, but overall it would help the entire shaping of the nose and the appearance. I also feel like it was quite long, so he was going to shorten it, and that comes with lifting the nose itself. When I walked away from my consultation, I got a phone call a few days later and I was ready to go ahead. I booked in my pre-operative assessment, which was about 3 months later, 2-3 months later. I felt completely comfortable, and I went again for my pre-op assessment, which is normally 1 to 2 weeks before your surgery. And when I went there, I actually went to the place where the surgery was about to be done in the morning, and there was a very supportive team there. I met everyone who was going to be there with me and accompanying me throughout my operation. I also met my nurse again, who was very helpful as always. I got to speak to Dr. De Silva about any last concerns. I think the only concern that I had was having my rhinoplasty done under sedation. I know that after researching it, this was the best option, the safest option, and for Dr. De Silva, he does all of his operations under sedation. I feel like now that I know that he is doing all of his operations under sedation, it makes me feel a lot more comfortable. I've also been able to speak to his previous clients that he's had, and they've said this experience of sedation has been so much better. I've never had an operation before, so going under GA would have been more frightening really. He's completely reassured me and said that the anaesthetic will be beside me throughout the whole operation. I wouldn't remember anything, it would just be an experience that I would be sleeping throughout the entire surgery, and I'll update you about that when I've had my op. I was a bit worried that I might wake up and, you know, flap my hands or something, but they said it doesn't happen. You're just sleeping in a very deep sleep, and you're breathing on your own, so it's a lot more safer. And after that, I feel more reassured, and I'm ready to go ahead with it. So now I'm going to get driving to London and hope for the best. I'll update you all tomorrow. Maybe a couple of hours after my surgery. I might feel a bit groggy after sedation, so maybe at night. So thanks guys, and I hope I've clarified everything and said everything. Bye.